Good morning, ladies and gentlemen. Our chapter today is chapter 15, and we are going to talk about respiratory system. And it is very important regarding this system, which we are like talking a lot of information, especially nowadays with the problem of COVID-19. Because as you know, COVID-19 is affecting the respiratory system and make a lot of trouble, and this trouble will be transmitted to affect other organs and system inside our body. And we need to be sure about the knowledge which we have and how we apply this knowledge regarding this respiratory system. First of all, as you know that this respiratory system is one of systems which we have inside our body, which is a living system, as you know. And what is the job of this system is gas exchange. So it has no job except gas exchange and also sound production. So let us talk about gas exchange. We know that we need oxygen and we get rid of carbon dioxide. And this carbon dioxide will be like in more concentration within our blood. So it will leave from the higher concentration, which is blood, to the lower concentration, which is inside the lung. So we get rid of carbon dioxide. On the opposite way, oxygen is in the air is more concentrated than oxygen in blood. So it will move from air to be loaded to the blood. And we know that we need hemoglobin, and this hemoglobin is very important to carry this oxygen by its content of iron. We need to know that plants, which is very important item in our life, that it takes this carbon dioxide with the sun and make oxygen by the chlorophyll character within the plants. So plants provide us with oxygen and eliminate carbon dioxide from the atmosphere. And we need to know that the total amount of oxygen within air is like 21% of the component of air, 21%. And as you know, oxygen is very important, and we measure the amount of percentage of oxygen by the use of pulse oximeter. And I think we had this chance before at class that the pulse oximeter gave me how is it is like a clamp, and this clamp attached to finger, and it will give me how is the pulse per minute and also how is the percentage of oxygen within our blood. We know that the average is like around 97 and above. But sometimes oxygen drop in the blood circulation, so it will reach less than 92. If we have a patient with oxygen concentration percentage less than 92%, so we have to give another source of supplement of oxygen like tank or like mask or like nasal tube, because below 92 is not recommended. And you know from your knowledge, I know that you are updated about the information that people with, God bless all of us, suffering from COVID-19, they start to suffer that the blood oxygen drop more and more. So a lot of people reach like 80s and more serious condition reach like 60 and 50. So how we provide them with this oxygen? We give oxygen with hyperbaric. What we mean by the word hyperbaric, it is more pressure. So it is not regular oxygen, but oxygen should be with pressure to like force oxygen to go from lung into the bloodstream. Respiratory system takes in air, remove the oxygen, and sends it through the blood while removing carbon dioxide, like we mentioned, the gas exchange. What are the parts of our respiratory system that provide us with the passageway till we reach to the cell? And we will talk later on that respiration will be subdivided into two categories: external respiration and internal respiration. From the word external, it belongs to factors outside the body till reach to the alveoli. And the internal respiration will be like talking about how oxygen coming from the alveoli to reach to the cell to be utilized by the cell. We have the opening of mouth and opening of the nose. And we know that we can breathe from our nose and we can breathe from our mouth. And you, as wonderful moms, you start to notice that your baby maybe breathes from mouth. And what is the problem? It is not healthy. And we mentioned before that breathing from nose is much better than breathing from mouth. But sometimes we have a problem within like nasal obstruction or rhinitis, like in common cold. So we start to breathe from our mouth, but this is like highly risk and it provides a lot of trouble. We will talk about this in details. What's the benefit to breathe from the nose? Another structure, which is the pharynx, and the pharynx has another traditional name, which is the thorax. And after that, we have, by the way, we mentioned last day when we talk about the medical terminology that the pharynx is going to subdivide it into three portions: portion behind the nose, portion behind the mouth, portion behind the larynx. So it is a common passageway between respiratory and digestive system. Then we are going to talk about the larynx, and this larynx is what we call the voice box. Why it is voice? Because it produces a sound. Why? Because it contains the two vocal cords which vibrate and produce the sound. Then we have the trachea, and the trachea, I told you yesterday that it is what we call windpipe. So when we apply the stethoscope over the trachea, we listen to the sound of air entry. Like if there's like wind outside and there's like a pipe, and we can notice that the pipe produce certain sounds. It looks like when we have breathing sound. Then the trachea will going to be subdivided into right and left bronchi, and this bronchi will going to be into more and more fine branches till we reach the terminal portion, which is the alveoli, which is has another name, which is air sacs. We had this slide yesterday and we talked about certain information, and we mentioned that we have the nasal cavity, and we talked about the lateral nasal wall, and we mentioned the parts of the pharynx, which we mentioned this nasopharynx behind the nose, and oropharynx behind the mouth, and the laryngopharynx behind the larynx. And I told you that we have very important structure which prevent food to come into the trachea while swallowing, which we call the epiglottis. And also we have another similar structure to prevent food and drink to go to the posterior nasal opening, which we call the uvula, and both are closing the content of the trachea and the posterior nasal opening while we are drinking or swallowing. And also, I told you yesterday, just to remind, that we mentioned about the trachea. And the trachea, as you see, it is like circle, and these circles will be like deficient posterior. We will talk about this very soon. And we mentioned that the right bronchus is almost on the same plane with the trachea. So foreign body inhaled will be like trapped in the right lung more than to go to the left lung, which is an important point. And we have here in this diagram a very important structure, which is the diaphragm. This diaphragm separates the thoracic cavity from the abdominal cavity. And you know that the diaphragm is very important muscle of respiration. Let us go to get details more. Starting by the nose, as I told you, the nose is a cavity that is divided by the nasal septum. And the structure of the nose is very important to make warm and filter the air. How we filter the air? By the cilia. What is the cilia? Cilia is hair that warm the air, and the conchi, which we had in the lateral wall, as I told you before, conchi, we have superior, middle, and inferior conchi, and the mucous membrane will also play an important role to trap the bacteria and fine particles. So I need you to save this information for the exam, that the lateral wall contain bony projection, and this bony projection is called what? Called conchi. Conchi is a plural, and concha is single. So we have three conchi: superior and middle and inferior. What is the benefits of this conchi? This receive the opening of paranasal sinus. We will talk about the paranasal sinus, and we have six, by the way. We will touch this point soon. We have six paranasal sinus, and you have to remember what is the names and the location. After that, we have what we call the throat, which is the pharynx, and it is the passage of food and air. This, what I mean, it is a common between respiratory and digestive, and connect the mouth to the larynx. How is this divided? We mentioned it is part behind the nose, part behind the mouth, part behind the larynx. We have another important structure, which is the epiglottis. I need you to pay attention for this epiglottis. So epiglottis will close the opening of the trachea, so it will prevent food and drink to get into the trachea and on the lung. And also, this epiglottis is very important if we have people, they have nerve paralysis, so epiglottis will not work. And sometimes when we are drinking or eating, we are taking breaths, and this will open the epiglottis, so we get choking. So be careful that when we are drinking or eating, don't like take deep breathing without stopping swallowing. As you see, this is very nice picture to let you know that we have vocal cords. This is in white, and these vocal cords are two, and they are running anteroposterior, and they are like vibrating on the effect of air moving through it. And these vocal cords are lining by mucous membrane, and it is like fold also, and this fold is called vocal cord. So sometimes in the exam, certification exam, give you the description that what is the mucous membrane fold, which is in the trachea, and it produces sounds. Of course, it will be like the keyword. So sounds means vocal cords. Okay? Any question? All right. The vocal cords move across the larynx when struck by air, and the vocal cords are held tense by contracting muscle. And we need to know that vocal cords differ from male and female. The vocal cords differ. This is why sound of female and sound of male. So what is the difference? The vocal cords in male are short and thick. Short and thick. The vocal cords in female are long and thin. So, according to this anatomical feature, we noted that the sound of female is little bit highly pitched. Why? Because thin and long vocal cords, so the vibration will or the sound will be like high pitched, not like in men. This is why we need to apply this knowledge to our practice. Sometimes when we get like laryngitis, I get inflamed or allergy or infection to the larynx, I will find that my sound changed. Why my sound changed? Because there is edema happen to the vocal cords. So when you call me or start to speak with me, I noted that your sound is not familiar to me like before. What's wrong? You have something which is like edema of the vocal cords. And also when we have like loud shouting all of a sudden. So sometimes we have blood drop like as an hemorrhage to be attached to the vocal cords. So we will get harsh sound. Very important this to notice that when we have edema or we have like trauma to the vocal cords, we find that our sound will be changed. The trachea, as I told you, is the windpipe and it has to be patent all the time, not like the esophagus. The esophagus, by the way, located behind the trachea. So if I ask you, Kellen, here the sternum, which is the chest bone, behind the sternum we have the trachea, and behind the trachea we have the esophagus, and behind the esophagus we have the vertebral column. So go in this order, like this lateral view. So sternum, then trachea, then esophagus, then vertebral column. If you go from back, vertebral column, esophagus, trachea, and the sternum or the chest bone. So this order is very important. Why? Sometimes, as I told you, the esophagus is not open all the time, but the trachea has to be open all the time. Even we are sleeping, so we have to breathe. So what is going on? Sometimes when we swallow big bolus, it will stuck here in the esophagus. So when the esophagus is like obstructed by this particle of food, not particle, like bulk of food, it will go forward like this and press over the trachea. And when the esophagus press forward over the trachea, so the trachea will be not open. So I will get difficulty of breathing. This is what we call choking, and we have to resolve this choking very fast. So normally the esophagus is not expanded, but the trachea has to be expanded. Why the trachea has to be open and how? Because it's all made of cartilage. The cartilage is C-shape. You see, like this, C-shape. So from anterior, there is the cartilage, and behind we have the esophagus. So when the esophagus expands, it will go into the trachea like this. So the trachea is patent all the time, and this is the esophagus. So I make it like one hand. So it go like this. When you swallow, the esophagus move forward. because the C shape is defect posterior, not anterior. So when we have big bolus, this big bolus will go and press over the trachea like this, and I will get difficulty or choking. I can't breathe. This mechanism is very important for us to understand that how is the mechanism of choking happen, and we have to relieve this obstruction as fast as possible. And this trachea will be divided into two sections called the bronchi. The bronchi will going to subdivide it into smaller and smaller branch. And we look to the picture of the lung and the bronchiole and the big trachea, the like trachea is like the main stem. It looks like inverted tree. When we have picture of tree, especially nowadays, we have like winter time, we don't have leaves. So when we look to any tree, it is away from leaves. So it has a main trunk, and the trunk get branches, and the branches. So this is like inverted picture of our trachea and lung. The alveoli is a plural. So we have like 500 million, approximately 500 million alveoli. And this alveoli is very tiny and very small sacs with very thin wall. Remember, question exam asking, is there any part in the respiratory system that gas exchange can happen? No, only the alveoli. So there is no gas exchange happen in the trachea? Yes. There is no gas exchange happen in the bronchi? Yes. And the bronchiole? Yes. None of all the part of the respiratory system can serve gas exchange except the alveoli. Why? This question. Because it is thin-walled, very thin wall, and it is surrounded by capillaries. And you know from the cardiovascular that capillaries also is very thin wall. So thin wall attached to thin wall make the movement across this membrane very easy. But there is no thin wall in the trachea, there is no thin wall in the bronchi or bronchiole or any part except the alveoli. So any disease going to destroy this alveoli or make this alveoli not has the character of thin wall, so the capacity of the lung for gas exchange will be also impaired. This what happened, God bless all of us, regarding the COVID. What is going on? The COVID will start to make like secretion, sticky secretion. This sticky secretion will be in the lower part of the lungs. So this sticky secretion will replace the function of the alveoli. So I am losing number of this 500 millions. So instead of having 500 millions, it will be like only 100 million. And if the disease is going to be advanced, so I will lose this huge number. So oxygen will not enter into my blood like before. So this is the mechanism. How is this COVID affecting our respiratory system? By creating very thick secretion, and this very thick secretion will prevent this thin wall alveoli to do its job to transfer oxygen to the blood. I hope it is clear for you. As I told you, when we invert this slide upside down, you find that it looks like tree. Okay, so this is another question in the exam asking you that the structure which looks like inverted tree, it will be this picture, which is the trachea and right and left bronchi and the terminal bronchioles till we reach the alveoli as you see. Any questions so far? All right. Sometimes we need to, actually, this slide is talking about external and internal respiration, as I mentioned you in the beginning. But this diagram is not for internal and external respiration. It is for tapping, what we call thoracocentesis. What is thoracocentesis? Thoraco means pleura. Thoraco means pleura. And this pleura is the lining or the covering of the lung. And if there is like fluid or there is like air, so we have to withdraw this fluid or air under what we call water seal. So as you see here, they are tapping this pleura and they aspirate the content of the pleura, which is like fluid or blood or pus. It depends. But let us talk about the text, which is we have external respiration and internal respiration. The external respiration is the process of getting oxygen from nose to the alveoli. So from nose till the alveoli, this is the external part. And what is the internal part? It is the exchange of oxygen and carbon dioxide at the cellular level. So the cell will get oxygen and get rid of carbon dioxide. Very important character for our alveoli. And this is another question, which is surfactant. What is surfactant? If I ask you guys that we have a balloon, when I inflate the balloon getting enlarged. Okay? After I remove this pressure, the balloon will collapse. Okay? When the balloon is collapsed, this is like our alveoli. When we get air in, it is expanding. And when it is like exhaled, so it will collapse. But when it is collapsed, it will never touch the surface to each other. It collapse but come back to expand by itself due to what? Surfactant. This surfactant is fatty molecule located on the respiratory membrane. Maintain what? Inflate alveoli so that it doesn't collapse between respiration. So the alveolar sac keep open all the time, not going to collapse completely like I told you. This is surfactant. And this is also very important because some people, they have problem with this surfactant and start to suffer from dysfunction of their lung due to absence of this surfactant. We have to know that each lung is surrounded by a sac. When I say sac, I mean it is double wall. And one wall of this sac is attached to the chest wall, and the other sac wall is attached to the lung. The one which is attached to the lung we call visceral pleura, and the one which is attached to the chest wall we call it is parietal pleura. In between the parietal and the visceral, we have the sac or the pleural cavity. And this pleural cavity should contain nothing. What do we mean by nothing? It is vacuum. What do we mean by vacuum? Because it is should be negative pressure all the time. Vacuum means negative pressure all the time. If there is any positive pressure, or if there is any fluid or any content in this pleural sac, the lung will not be able to expand and it will be like collapsed lung. And once we remove anything from this pleural sac, the lung will expand again by itself. So this is why we do the thoracocentesis technique, which we had in the previous slides, to remove any positive pressure or any content within the pleural cavity. Very important, this cavity to be like containing the fluid, which is mucus secretion, and this mucus secretion is to prevent friction during respiration. But it doesn't mean that this mucus secretion is a disease. No, this is the normal like consistency of the mucous membrane. What about muscles of respiration? We have very important one, which is the diaphragm. And the diaphragm, as I told you, separate the thoracic cavity from abdominal cavity. And it is very important for us to know that it is a muscle. This muscle is like the only muscle can work voluntary and involuntary. So if I ask you, it is smooth muscle or it is skeletal muscle. As you know, skeletal muscle is working voluntary. So I have to do this job by myself. But how can I do this if I am like sleeping? So it is working dual action, working as voluntary and at the same time work as involuntary. If I ask you, Shirley, hold your breathing, so you can do this. Start breathing, you can do this, so you can control this action by your nervous system control. But if you are like in deep sleep, or God bless you in under anesthesia, you still keep breathing. Why? You are keeping breathing because it works involuntary. So this diaphragm working into situation with two different mechanisms, voluntary and involuntary. How this happen? When the diaphragm contracts, like I consider this is my two hands is the diaphragm. When it contracts, it will make like this. And when it make like this, you notice that the abdominal content is pushed down. If I ask you, let us do this experiment together. So the diaphragm push down the abdominal content, and according to this, we noted that the chest is getting raised. So the chest is getting raised due to the intercostal muscles, and the diaphragm push down the content, so the capacity of the chest will increase. And when the capacity of the chest increased, the negative or the pressure inside the chest will be negative. According to this, air will come into my lungs by pressure gradient, and vice versa. When the diaphragm relax, so it come back to its original size, so the chest cavity will decrease in content, and the intercostal muscles also will relax, so the chest will collapse. And when it collapses, it creates positive pressure, so it will push air out of my nose. So this is exhalation. So the mechanism of respiration is very important, and you have to understand that when you take deep breathing, you notice that the chest is rise and the abdominal contact push down, so the chest cavity will get bigger and at the same time create negative pressure. And the versus happen when exhalation. Breathing is controlled by the respiratory center in the brain stem. As I told you before, that the brain stem containing all the vital signs for or the vital center for vital signs, respiration and pulse and blood pressure and so on. The increase in carbon dioxide or a drop in oxygen trigger the respiratory center for respiration. So I need to explain this point for you. The increase in carbon dioxide in the blood, of course, or drop in oxygen, also in blood, trigger respiratory center to force respiration. So if I don't have carbon dioxide within my blood, so this means respiration will stop. So if I ask you, if I give you pure oxygen, and your blood is not containing any carbon dioxide, so respiration will stop. So at least, so you will say that, so this means what? Can I get 100% oxygen with the pulse oximeter? You will say that I have a wonderful healthy person that he has 100% oxygen. I will say that this never happened. Never happened. Because at least I need 1% of carbon dioxide, otherwise respiration will stop. So we can get 99% oxygen concentration in the blood, but never we can get 100%. You understand what I mean? Okay. So that sometimes I have students when we start to practice we say that, Dr. Israel, why I don't get 100%? I say that if you get 100% concentration, you will never be able to breathe. So this like 1% or 2% of carbon dioxide inside our blood give the oxygen percentage, which is like 98 or 99 or 97, as I told you in the beginning, is the optimum or the standard to be for people. Okay, guys? Sometimes our respiration is like stopped. When coughing. Of course, you are coughing, so you are not going to take breathing. This is why sometimes we have very aggressive coughing when we have chest infection. So you say that I lost my breathing from this cough. So during the act of coughing, we cannot take breathing. Also, when we have like spasm to the diaphragm, this is what we call hiccup or hiccup. Both are correct. So this irritation makes stoppage of respiration. So if this hiccup is like stay for a long time, and by the way, you as a medical assistant put in your mind that people with increased blood urea, when they have kidney failure and the blood urea is high, they have hiccup. Sometimes we have hiccup after meal. Sometimes we have hiccup during any time of our daily activity, but it is not a disease. But it will be like persistent hiccup. So think about increased blood urea, or this patient may be having problem with the kidney as chronic renal failure. Another mechanism that is like happen and stop breathing, which is sneezing. If we have anything irritating our nasal mucosa and we start to sneeze, so during the act of sneezing, you are not capable to take breathing. Also, yawing. When we are yawing, it is like we cannot take breathing. Of course, also during crying. Of course, when we are crying, we cry and stop to take breathing and continue cry again. But you cannot cry like continuous. No one can cry continuous. He will like get cyanosis and unable to take breathing. What is the diagnostic examination for this respiratory system? As you learn it, guys, this is the only technique which is with phlebotomy, when you get the class of phlebotomy, that we can check for arterial blood gases. Arterial blood gases. What is the arterial? We are going to measure both oxygen, carbon dioxide, and the arterial side. You know that how to do this. And another test, which is bronchoscopy. The word scopy means examination to visualize. So we insert inside the trachea certain scope, and this scope will be like having a camera so we can see the content of the bronchi if there's like foreign body or um, tumor or mass or whatever. Another way to examine the lungs is CT scan. And of course, as you know, soft tissue examination is much better to be done by CT scan, but bony part to be examined by chest X-ray. So we can do chest X-ray to look for like the costophrenic angle or to determine the feature of the mediastinum or the heart. Maybe like the heart is like enlarged, or maybe one of the lung has foreign body or it has like collapse. So X-ray will help, but to study section within the soft tissue of the lung, we have to go through the CT scan. And this CT scan is so good to give us clear image about uh, uh, the situation. And as I told you, uh, chest X-ray is very important in the situation I told you, like foreign body, or to examine the ribs and examine the shadow of the lung and the shadow of the heart and the shadow of lymph nodes and the mediastinum, or if we are looking for like lobar pneumonia, so we will find that the architecture of the lung is like totally not seen. All right. A lot of examination uh, to be like done when we have advanced case of lung problem. As you see, uh, a lot of list here, but we are like focus on pulmonary function test. And this pulmonary function test can be done by what we call spirometer. And we watch it together, the video for how to use the spirometer, and the result which we get as how is the volume of air entering into into the lung and coming out of the lung. And I think you have already the video, and I'll try to repost again the video for spirometer, how we use it, and what is the data we collect from the spirometer. As I told you in the beginning, the pulse oximeter, and the pulse oximeter is give us two reading, pulse and oxygen. The pulse is how many beats per minute, and oxygen is a percentage. So I am focused on the word percentage because this is question in the exam, asking you that the reading you get from pulse oximeter is what? You have to be remember and smart. It is going to count pulse per minute and the oxygen percentage. So it will be in a percentage, not any other number, percentage. Another test we do, like we have chest infection or we have a patient with suspicious of tuberculosis, so we have to make sputum analysis. And this sputum analysis, we can diagnose a lot of items like bacteria, like Corynebacterium tuberculosis. Also, we can diagnose if there's like blood or also in case of cancer. The word thoracocentesis, which I mentioned to you with the previous slides, that we are going to withdraw of fluid from the pleural space by needle, and this aspiration will be like, of course, done under local anesthesia. We start to talk about diseases affecting the respiratory system. One of the common disease we will start to talk about it is allergic rhinitis. Then we are going to talk about asthma. We, as you know, that we have this chapter to be covered in 2 lectures. So we will going to stop this lecture at this point, which is the disease affecting the respiratory system. And this is very important for everyone to be familiar about that this disease, how it looks like, and what is the system or what is the part of the system to be affected. We will stop at this point for today. If you have any question, of course, you are so welcome. And that's it.